Lawrence is a city in northeast Kansas with a population of about 100,000 people. Lawrence is located in Douglas County. Here are some facts about Lawrence and the Douglas County area.
In regards to our underserved population of Lawrence, Kansas, 22.3% of our residents live below the poverty line. 1 in 7 do not have health insurance. And the rates of our homeless populations have increased by 35% in the last year alone. Also, about 20% of our state's Medicare population is currently battling depression.
And this is where RockChalk Rx comes in.
The mission of RockChalk Rx is to provide the Lawrence community with sources to medication information and overall health information, as well as free access to care.
Here's our plan: to provide mobile services to the underserved of Lawrence by partnering with different local centers for community outreach on a weekly basis. At the local centers, providing the people we're serving with MedInfo reviews, where we meet and have a one-on-one conversation with the patient and talk about the medications they're taking as well as their overall health. We do this while maintaining individual privacy using room dividers. Our goal is to provide medication info reviews where we meet with patients in a one-on-one setting to discuss their medication regimen. First, we'll gather a patient's current medication list and make sure that they understand what each med is for. We'll then assess their regimen and make recommendations that they can discuss during their next doctor's appointment. We'll also schedule follow-up appointments to see how patients are doing. At the end of the review, patients will be provided with a MedInfo packet that includes a pill box, information on local free clinics, and also a laminated front and back list of common medical terms and what they mean in patient-friendly language. We'll also provide patients with blood pressure and blood glucose checks, as well as logbooks, so they can keep track of their results. Clinic will include a scale so that patients are free to weigh themselves whenever. In October, we'll provide free flu shots, and year-round, we'll give free smoking cessation information. Also, patients in need will be connected to manufacturer-sponsored patient assistant programs for insulin and HIV PrEP. Here's our vision. In January of 2020, we'll begin advertising and training RockChalk Rx volunteers. We plan on going live the end of January. In February, we will implement a focus on heart health in alignment with the American Heart Health Month. In March, we'll do the same with National Kidney Month by implementing a focus on kidney health. We will continue to advertise the program throughout the whole process.
The Lawrence Public Library is one of the local centers we have partnered with for RockChalk Rx.
RockChalk Rx is a project by SNPhA KU, and they're going to be incorporating the library in some of their programming. And I think that it's a really great partnership because there's a huge variety of people who come to the library from all socioeconomic statuses. They're going to be doing some drop-in outreach sessions and talking to different community members about prescriptions and health literacy, and really helping out members of Lawrence and Douglas County that aren't typically reached. They're often ignored or talked down to, or just kind of misrepresented. So I think that this is a really great opportunity for these groups to reach actual people who care and actual professionals.
With the $2,500 that would be given to us from Prescription for Service, we would use it to prepare our MedInfo packets, which would consist of pill boxes, resources to free health clinics here in Lawrence, Kansas, as well as a health literacy dictionary. A completed list of what we'll use the money towards is listed here.